Hey everyone, ready to explore the world of wearable health tech? It's a wild ride, let me tell you. We're digging into a ton of YouTube videos for this deep dive, from WebMD to the medical futurist, to get a sense of where things are headed.
It really does feel like we're on the cusp of a revolution. Like, will this tech make us healthier, or is it all hype?
It's a great question because we've got these promises of, living longer and healthier, but then there's this other side of things too.
Yeah, like in WebMD's video, Three Wearable Health Tech Wonders, they show all these amazing things like wristbands that track your blood oxygen and hydration, and even, get this, smart contact lenses that monitor blood sugar.
No more finger pricks, sign me up.
Right. It sounds pretty incredible. But then we watched Dr. Mike's video asking Dr. Mike about fitness wearables, and it kind of made me think twice.
Yeah, Dr. Mike brings up this important point about the healthcare industry sometimes being more focused on profits than on, actually proven results.
Yeah, like pushing products before we really know if they work or if they're even helpful.
He makes this analogy about a water bottle grip that's supposed to stop you from dropping it.
Right, like it's a cool gadget, but is it really solving a problem? And then he goes on to compare it to water that claims to cure depression.
Okay, that's where I draw the line.
Exactly. And the thing is, Dr. Mike is a doctor, and even he admits he doesn't always know what to do with all the data from these devices.
He actually talks about using the Apple Watch ECG feature, like he was getting readings but didn't know what they meant or what to do with them.
Yeah, so if doctors are struggling with this, I can only imagine how confusing it must be for everyone else.
So true. It feels like we're drowning in data but without a life raft to make sense of it all.
And that brings us to another concern that Dr. Mike raises, which is the potential for all this data to actually increase health anxiety.
Yeah, like what if you're constantly checking your stats and getting notifications about every little glip, but you don't really know what it means? That would stress me out.
Totally. And he even shares a story about a patient whose heart rhythm issues actually got worse after they got an Apple Watch.
Wow, that's definitely a cautionary tale.
It is. I mean, don't get me wrong, this technology has huge potential, but it's like anything else. We need to be smart about how we use it.
We need more research, better guidelines, and maybe even just a new way of thinking about health data in general.
Yeah, it's not just about collecting data, and it's about making sure that data is actually useful and helpful.
So we've got this exciting potential on one hand and then some very real concern on the other. It's a lot to unpack. I'm curious what the AMA has to say about all of this.
Oh yeah, they have this video, Healthcare Technology Trends 2025, that tries to cut through the noise and offer some perspective.
Okay, so less hype, more substance.
Exactly. Dr. Margaret Lozavatsky, she's the AMA's VP of Digital Health Innovations, and she really stresses the importance of what she calls thoughtful implementation.
I like the sound of that. So what does thoughtful implementation actually look like?
Well, one of their big focuses is on helping doctors deal with the sheer amount of information coming from these devices.
Yeah, it must be overwhelming for them, like trying to drink from a fire hose.
Totally. And Dr. Lozavatsky mentioned this crazy stat. Doctors today manage something like 1,300 data points per ICU patient compared to just 750 years ago.
Whoa, that's a huge difference.
Right, so the ANA gets that this is a problem, and they're trying to find ways to make all this data more manageable.
So it sounds like they're taking a more proactive approach.
Definitely. They want to learn from the mistakes of the past and make sure technology is actually working for doctors and patients, not against them.
I'm all for that. So they're not just talking about the problems, they're trying to come up with solutions.
Right. They have this initiative called the Physician Innovation Network to help doctors work directly with tech developers.
That's a great idea, bringing the two worlds together.
Yeah, it's about making sure the technology being developed actually meets the needs of healthcare professionals and patients in the real world.
So far, we've been focusing on smartwatches. But let's be real, the world of wearable health tech is way bigger than that.
Oh yeah, for sure. We found this really interesting video from Scripps News called How Effective is Wearable Health Tech? And they cover all sorts of stuff, like neurofeedback glasses, BCI sleep aids, and even smart clothes with sensors woven in.
It's mind-blowing, like every part of your body could be tracked.
And the applications are incredible, like think about the Vice blood glucose sensor.
Oh yeah, continuous monitoring, way more insight than just a one-time finger prick test, right?
Right, and then the medical futurist takes it a step further. He has a tier list of digital health devices.
Ooh, like a ranking system.
Yeah, he ranks different wearables based on how practical they are and how user-friendly they are.
I'm always looking for recommendations, so that's great. What's he a fan of?
Well, he seems really impressed by smart sleep alarms. He says they can help you wake up feeling more refreshed because they wake you up at the best point in your sleep cycle.
Yeah, that's something I could use.
Right, so many people struggle with sleep, so finding ways to improve it is a big deal.
Absolutely. So smart sleep alarms get a thumbs up. What about some of the other devices and metrics he ranks?
He's a big fan of risk-based blood pressure monitors. He says they may not be as accurate as the ones that go on your arm, but they're much more convenient.
I can see that. Remember those old school blood pressure cuffs? Those things were uncomfortable.
Exactly. So having something that's easier to use could be a game changer for a lot of people.
Totally. And he also had some good things to say about smart rings, right? Like a good alternative if you don't want a big smartwatch on your wrist.
Yeah, he puts those in his fine experience tier. They're a little more discreet, but still track a lot of the same stuff.
I can see the appeal of that. All right, so we talked about the potential, the challenges, the ethical stuff. Now I want to look ahead, like what's coming next? What can we expect from wearable health tech in the future?
Well, the CBS Sunday Morning video, tracking your health data through wearable devices, painted a pretty fascinating picture. Imagine these devices becoming even more integrated into our lives.
Like smaller and even more powerful?
Exactly. They talked about how wearables could monitor things like sleep patterns, heart rate variability, even how you walk. It's like having a personal health detective with you all the time.
Wow, that's a bit creepy, but also pretty cool.
I know, right? It's exciting, but also a little unnerving.
It really is. And then there's the whole privacy issue.
Oh, yeah. That's huge. I mean, it's one thing to track steps, but it's a whole other level when you're talking about things like blood sugar, heart rate, and all those other personal metrics.
It raises a lot of questions about who has access to that data and what they're doing with it.
Right, like, is it being sold to advertisers, used for research without our consent? It's scary stuff.
It definitely is. Okay, so we've covered a lot of ground here. We've explored the good, the bad, and the just plain weird of wearable health tech. I think our listeners have a lot to think about.
They do. It's such a complex and rapidly changing landscape, and we're all trying to figure out how to navigate it.
Well, before we wrap up this part of our deep dive, I want to bring up one story that really stood out to me during our research. Remember, we talked about the potential for early disease detection?
Yes.
Well, there's this Stanford professor, Michael Snyder, who was using his own research app and a smartwatch to track his health data, and he actually detected early signs of COVID-19.
Oh, wow.
Yeah, his smartwatch was tracking things like his heart rate and skin temperature, and his app flagged some unusual changes in his data before he even started feeling sick.
That's incredible.
It really shows the power of this technology. Like, it could potentially help us catch health problems before they become serious.
That's a game changer.
It really is, but it also highlights the need for, like, better algorithms and ways to interpret all this data. We don't want people getting false alarms all the time.
True, that could lead to more anxiety, not less.
Exactly. So there's still a lot of work to be done.
Oh, for sure. But it's an exciting time to be following this technology, that's for sure.
It really is. It's crazy to think how much this technology has evolved. We've gone from simply counting steps to gathering all sorts of data about our bodies.
Yeah, it's mind-blowing. But it's not just about the data itself, right? It's about what we do with it.
Totally. It's got to be useful. Like, how can we use this information to actually improve our health?
Right, and that's where things get a bit more complicated. Because as we've seen, not all wearables are created equal. Some are better than others.
So how do we figure out what's worth our time and money? It's a jungle out there.
Well, that's where resources like the Medical Futurist can be really helpful. Remember that tier list he put together? He ranks wearables based on their practicality and user experience. So it's a good starting point.
Yeah, I remember that. He seemed to really know his stuff.
He does. And one of the things he was particularly impressed by was the continuous blood glucose monitor, like the one from Vis. He was saying that it provides so much more insight than just doing a finger prick test every now and then.
Makes sense. Continual monitoring gives you a much better picture of what's going on in your body.
Exactly. You see how your blood sugar responds to different foods, different activities. It's a whole new level of understanding.
It's like having a personal nutritionist on your wrist telling you exactly how your body's reacting to everything you eat. Pretty cool, right?
It is, and it highlights the potential of wearables to really personalize health management. It's not just about tracking anymore. It's about understanding and making informed decisions.
But even with all this data, I feel like a lot of people still struggle with knowing what to do with it. Like, okay, my blood sugar spiked after I ate that donut. Now what?
That's a great point. Data without context can be overwhelming and even unhelpful.
So what's the solution? Do we all need to become data scientists just to manage our own health?
Huh. I hope not. But I do think we need better tools and resources to help us interpret and act on our health data. And that's something the AMA is really focused on.
So they're not just thinking about the development of these devices, but also about how to use them effectively.
Right. It's about bridging that gap between raw data and practical advice. Like, what does this data actually mean for you? And what can you do about it?
It's like translating data into something we can all understand and use to improve our lives.
Exactly. The goal is to empower people, not overwhelm them with a bunch of numbers they don't know what to do with.
Speaking of feeling overwhelmed, there's one aspect of wearable tech that I think we need to discuss a bit more. It's something we touched on earlier, but I think it's worth diving into a bit deeper.
Sure, what's that?
It's the potential for these devices to actually fuel health anxiety. We talked about Dr. Mike's patient who got an Apple Watch and ended up feeling worse, remember?
Yeah, I remember that. It's a real concern. While these devices can be incredibly insightful, they can also make people hyper-aware of every little change in their body.
It's like suddenly you're tuned into all these signals you never noticed before, and it can be a bit unsettling.
Especially if you don't know how to interpret those signals or what to do about them, it's easy to jump to conclusions and start worrying.
It's ironic, isn't it? We get these devices to be healthier, and then they make us more anxious about our health.
It is a bit of a paradox. I think it all comes down to being more mindful and intentional about how we use these devices.
So, what does mindful use look like? What are some tips?
Well, I think it's important to be selective about what you're tracking and how often you're checking the data. You don't need to be bombarded with notifications every time your heart rate goes up a beat or two.
That makes sense. It's about finding a balance between staying informed and not getting obsessed.
Exactly. And it's also about being critical of the data you're seeing. Don't take every reading as gospel truth. Sometimes there are fluctuations that are totally normal.
So basically, don't freak out if your heart rate goes up while you're running to catch the bus.
Exactly. Use common sense, and if you're truly worried about something, talk to the doctor. Don't rely solely on a wearable for diagnosis or treatment.
These devices are tools, not replacements for our own judgment or for medical professionals.
Right, and I think that's an important takeaway as we continue exploring this topic. Wearable health tech is powerful, but we need to approach it with a healthy dose of skepticism, common sense, and a focus on what truly matters.
Okay, so we've discussed the potential benefits, the challenges, the ethical consideration. Now I want to shift gears a bit and look ahead. Where is all this technology going? What can we expect in the future?
Well, it's probably safe to say that wearable health tech is only going to become more sophisticated and more integrated into our lives.
So even smaller, more powerful devices tracking even more data. Like, what's next?
Exactly, and it's not just about tracking, it's about analysis and providing personalized insights. Think about a smartwatch that not only tells you your blood sugar is high, but also suggests what to eat to bring it down.
Or a fitness tracker that analyzes your form while you're working out and gives you tips on how to improve.
Or a sleep tracker that actually adjusts your sleep environment, like the temperature or lighting, to help you sleep better.
Wow, that's like science fiction.
I know, right? It's all about moving beyond basic tracking and toward true personalized health management. I think we're just scratching the surface of what's possible.
It's exciting, but it also brings up a lot of concerns. We talked about health anxiety, but what about privacy? I mean, all this personal data being collected, it feels a bit vulnerable.
You're right. Privacy is a huge concern. Who owns that data? How is it being used? These are questions we need to be asking as this technology advances.
It's a bit unsettling, honestly. It feels like a double-edged sword.
It is. We need to advocate for transparency from these companies for control over our own data and push for stronger regulations to protect our privacy.
So it's not just about being excited about new gadgets, it's about being informed and demanding better protections.
Exactly. We need to be critical and think about how this technology is being developed, how it's marketed, and how it fits into our lives, making sure it serves our well-being and doesn't become another source of control or stress.
This brings us back to Dr. Lazavatsky and the AMA's call for thoughtful implementation. We need to be cautious, right?
Absolutely. We need to be aware of the potential downsides and not just blindly embrace every new piece of tech that comes along.
Okay, good point. But beyond privacy, what are some other potential downsides we need to be aware of?
Well, one concern is that we become too reliant on these devices. What if we lose touch with our own intuition and body awareness?
Like, if our smartwatch tells us we're not getting enough sleep, but we actually feel rested, do we ignore how we feel and just trust the data?
That's a great example. It's important to remember that these devices are tools. They should enhance our health, not dictate it.
We need to find the right balance, right? Using technology to support our well-being without letting it take over.
Absolutely. And I think that's a great point to keep in mind as we continue exploring this topic. Wearable health tech is powerful, but we need to approach it thoughtfully, critically, and always prioritize our own well-being.
Well said. Now, before we move on, I want to share a story that really stood out to me from our research. It highlights the potential of this technology for early disease detection. Remember we talked about that?
Oh, yes, definitely.
Well, this Stanford professor, Michael Snyder, was wearing a smartwatch that tracked all sorts of metrics. And get this, it actually helped him detect early signs of COVID-19.
Whoa, really?
Yeah, the smartwatch was tracking things like his heart rate and skin temperature, and his app flagged some unusual changes in his data before he even started feeling sick.
It's incredible. It's like a glimpse into the future of preventative healthcare.
Right, imagine being able to catch diseases early on before they become serious. It could be a game changer.
It really could. But it also highlights the need for better algorithms, more accurate data interpretation. We don't want people getting false positives all the time.
That's true. We need to make sure this technology is reliable and doesn't cause undue stress or anxiety.
Right. It's a balancing act. But it's an exciting time to be following this field, that's for sure.
It really is. I mean, who knows what incredible breakthroughs are just around the corner. Maybe we'll see wearables that can predict and prevent chronic diseases or personalized AI coaches that guide us towards optimal health.
The possibilities are endless. But it all starts with awareness, understanding, and a willingness to engage with this technology in a thoughtful and informed way.
It's exciting, right? But we got to be cautious too.
Oh yeah, for sure. It's powerful technology, but we need to use it responsibly. And that starts with being informed.
And engaged. That's what this deep dive is all about. We've covered so much, from continuous glucose monitoring to the potential for early disease detection, like Dr. Snyder's case. But we also need to remember all those other things. Thoughtful implementation, data privacy, the potential for health anxiety.
Right. And don't forget the sheer variety of devices out there. Headbands, rings, clothes. It's gone way beyond the basic fitness tracker.
Our bodies are like walking data centers, which is cool, but also a little scary. Who has access to all that information?
Data privacy is a big one. We need to demand transparency from companies. We need control over our own data and regulations that actually protect our privacy.
So it's not just about being excited about the new gadgets. We need to be smart about it.
Totally. We have to think critically about how this tech is being developed, marketed, and used. Make sure it benefits us and doesn't become another source of stress.
This brings us back to the AMA and Dr. Lozovatsky. They're really pushing for thoughtful implementation. It's not about using technology for everything. It's about using it in a way that makes sense.
And they're focused on helping doctors deal with all the data. Remember that stat, 1,300 data points per patient. It's insane.
Yeah, no wonder some doctors feel overwhelmed.
Exactly. So the AMA is trying to find ways to make that data more manageable, tools to help doctors make sense of it all. And they're encouraging collaborations between doctors and tech developers.
Like that physician innovation network we talked about?
Exactly. Trying to make sure the tech is actually useful and doesn't just add to the problem.
It's like building a bridge between the tech world and the medical world.
Exactly. It's a two-way street. Developers need to understand the challenges faced by doctors, and doctors need to be involved in shaping the technology.
And it's not just up to them, right? We, the users, need to be informed and engaged too.
Absolutely. We all have a role to play in making sure this technology is used responsibly.
Like we're all part of this big experiment figuring out how to integrate wearable health tech into our lives.
Right. And who knows what the future holds? Maybe we'll have wearables that predict and prevent diseases, or AI coaches that guide us to be healthier.
The possibilities are amazing, but it all starts with awareness, understanding, and using this technology in a thoughtful way.
Well said.
So as we wrap up this deep dive into the world of wearable health tech, we want to leave you with a question. What stands out to you as the most promising aspect? Or the most concerning? What questions do you still have about this technology and how it might affect your life and the future of healthcare?
We encourage you to keep exploring, keep asking questions, and stay engaged in the conversation, because the future of health is in our hands, or maybe on our wrists.
Thanks for joining us for this deep dive. Until next time, stay curious, stay informed, and stay healthy.